Therafirm was purchased by Knit-Wright in 2000. The existing ownership for Knit-Wright purchased Therafirm in 2006. And from that point is when Therafirm started to grow by leaps and bounds. So they liked working in Richmond County, the relationship with Richmond County, and found a facility here in Hamlet that was available. They then came in and performed the construction on it, remodeled the plant, and developed a state-of-the-art manufacturing facility.
Therafirm is a unique company because we make medical compression hosiery. I think it's pretty unique in the fact that it's still a textile company that is here in North Carolina, where a lot of the other ones have closed down.
Therafirm, during the time that textiles was going offshore, Therafirm was growing jobs, creating careers in Hamlet, North Carolina. We have taken advantage of the latest and greatest technology in the plant, doing what needs to be done to maintain a competitive advantage and to maintain the jobs here in North Carolina.
What I hear from our customers is that most of the global market is trying to source product made in the USA because they consider it superior.
To me, what makes Therafirm products special are that they're made here in Hamlet, North Carolina. Also, the pride that the employees take each day to confirm that they're making a good, high-quality product that's going to improve the patient's life is what's most important to me.
Therafirm, during the time here at Hamlet, we've tripled the workforce, and that's been important to not only Richmond County, but the surrounding counties where we do draw our employees from.
I love the environment. I love being here. The people are friendly. I like helping, making stuff that could possibly save someone's life.
Therafirm's a great company to work for. It's like a family. They care for their employees. We have great benefits. And while things do get stressful sometimes, it's still a great place to work.
We are a small company, which is not a bad thing because everybody knows everybody, and we all just feel like family when it comes to getting together for our monthly events or just daily activities. We are pretty close.
We have encouraged the employees to take ownership, to provide feedback, and to help us grow. The employees have embraced that. They come forward with ideas, thoughts, suggestions on how we can improve things, how they can actually make their job better.
I am very passionate about the products that we make and the job that I have. It's been very important to lots of patients and consumers that they have the correct compression, and it's nice to know that we go the extra step and the extra mile to make that happen for those who need it.
We were fortunate enough and honored to have received the 2017 Governor's Export Award for rural North Carolina. We've been fortunate, successful, blessed, and again, I think that comes from our employees and their abilities and their passion for what they do at Therafirm and the medical legwear that we produce right there.
You might be asking, what is compression? Very good question. Compression is the act of applying pressure to certain areas of the body to help increase blood flow. It comes in many different shapes, sizes, and colors and can serve multiple different purposes. Using compression as a medical therapy isn't new. Hippocrates, the Greek physician who is considered the father of medicine, was an early proponent of a rudimentary type of compression therapy. That was BC time, folks. Somewhere between ancient Greece and 2021, some really smart scientists and doctors developed what we know of as medical compression. You might have learned of gradient compression, or maybe you know the term TED hose. These are two types of compressions used for medical benefit. But what is the difference? A great deal, actually. The TED in TED hose stands for thromboembolism deterrent. And if that isn't a mouthful, I don't know what is. TED hose are specifically designed to help reduce the risk of developing deep vein thrombosis, or a blood clot in your lower leg. This typically happens after surgery or other conditions that keep you bedridden. These stockings contain low levels of continuous compression that prevent the blood from pooling, encouraging it to circulate around the legs. Promoting increased blood flow prevent these dangerous conditions like DVT to occur. But these types of compression hosiery are not good for anyone who is ambulatory, because they do not offer enough support to counter the effects of gravity. That's why we also have gradient compression hosiery. Gradient compression stockings or socks apply the greatest amount of pressure near the ankle. This pressure decreases as it extends up the calf and into the upper leg. This gradual decrease in pressure encourages blood to flow back to the heart, helping to prevent or improve conditions like varicose veins, skin ulcers, DVT, and lymphedema. Gradient compression can also help people who are on their feet a great deal. People who travel, pregnant moms, athletes looking for a healthy way to improve performance and recovery, or anyone experiencing tired, achy legs and needing a boost. We hope that you'll turn to Therafirm to help you with all your compression questions and compression needs. Therafirm understands the challenges to patient compliance, which is why our compression products are designed with compliance in mind. We've addressed the biggest challenges to wearing compression in each of our product designs. It's hard to change daily habits, especially if there is considerable effort or discomfort that must accompany the change. That's why getting sizing right is so important. Sizing for compression isn't like sizing for other garments. An approximate fit just won't do. It's important that patients be properly measured for their compression stockings. Our compression socks and stockings fit most wearers in minimal sizes. Most of our products are available in short and long to accommodate a higher range of leg lengths. One of the biggest challenges to patient compliance is the ease of donning and doffing. Let's be honest. Compression garments traditionally are very difficult to put on, especially at the higher compression levels, and no one wants to struggle to get dressed day in and day out. Like its name, Ease by Therafirm offers patients an easier garment to don and doff, and our core spun socks are patented to address this very issue. Both are made with premium ultra stretchy yarns to allow wearers to put on and remove stockings without resorting to contortions or gymnastics. We promise. Costs can also be a big factor in compliance. If stockings are too expensive, or if they wear out too quickly to replace often enough, patients will be reluctant to continue wearing them. One of the best things about Therafirm branded compression is that they are affordable. Premium quality materials used to make this hosiery hold up better to everyday wear and tear, lasting longer before needing to be replaced. And when they do need to be replaced, they aren't going to strain the wallet in the process. What's the first thing that comes to mind when you think of compression stockings? Is it the rough and scratchy texture of the fibers that so many of them are made of? You won't find that with Therafirm products. We ask a lot of our yarns. Along with the premium stretch, they're also super soft. Our opaque, sheer, and even microfiber yarns are like no compression garment you've ever experienced. Our core spun socks even offer gradient compression in a sock that feels more like an everyday sock. If the lack of comfort wasn't the first thing you thought of, it was probably the lack of fashion. No one wants to be stuck wearing grandma style stockings every day. Not even grandma likes that look. Our products are made of beautiful yarns in stylish and fashionable colors and patterns. Whether you prefer opaque, sheer, microfiber, or even a more casual everyday sock, Therafirm brands offer the latest fashions. People won't even know that you're wearing compression unless you tell them, because our styles look like hosiery you would choose anyway. This is not your grandma's compression wear. We hope that you'll turn to Therafirm to help you with all your compression questions and compression needs.
Good afternoon, everyone. My name is Todd McLaughlin. I'm the Vice President of Sales for Therafirm Compression, and I'm very fortunate this afternoon to be joined by Donna Kelly, who is a vascular technologist with a specialty in venous ultrasound. Donna practices at Middlesex Surgical Associates in Winchester, Massachusetts, and is part of the Leahy Health Group. So thanks for answering a few questions for us today, Donna.
Thank you for having me.
Absolutely. So can you tell everyone a little bit about what you do every day in your practice?
Sure. So I do vascular ultrasounds in a surgical private practice. For the last 15 years out of my 25-year career, I've focused specifically on venous disease. So I spend a lot of time doing ultrasound on patients that have problems with their veins, specifically venous insufficiency or varicose veins. Spend a lot of time with those patients, which I think is what we're here to talk about today.
Absolutely. So in that group of patients today, we'd kind of like to focus a little more on the moms, if we could. Sure. Can you tell me some of the common things that you see when moms come in to see you, when they come to see you, what symptoms they might be feeling to decide to come and see you?
Sure. So what we see, what's really common with the patients is we mostly see the patients after they've had babies, honestly. And the common theme with these patients is the more pregnancies they've had, the more babies they've had, the worse their veins are. And the one thing that we have to kind of keep in mind when we talk about veins is the veins, they get worse with the pregnancies, with each pregnancy, is because as somebody's pregnant, their hormones are allowing their veins to overstretch. And there's a reason to that, because they have to have added blood volume for the babies. So, their veins are overstretching, and with more pregnancies, they're stretching, and eventually the veins can't go back to their normal size. And this is why they by the time they're 2 or 3 pregnancies in, their veins just aren't able to rebound back to normal. So this is to the point where they say, okay, I'm ready to do something about this. So they come to see us. And the symptoms that they're typically complaining about are not only visual, which is what some people think. These people are actually suffering from achy, tired, heavy legs that have some swelling that go along with them.
Okay. And what can you and the physician do for them as a solution?
So there's lots of different options, and ultrasound is an important tool because what it's going to do is help us to determine which veins are involved. There's lots of different veins in our legs. Some of the veins we can see, and those are the varicose veins. More importantly, what we need to know is which veins are involved, and that's where the ultrasound comes in. I always talk about veins like they're trees. So the veins that we can actually see are the branches of the trees, and we know the branches aren't working just by looking at them. So my job as the ultrasound tech is to look at the trunks of the trees. Do the trunks work or not? And then which trunks are they? And then what we can do is once we know that, the doctors will look at that and look at the ultrasound, and they say, okay, these are the veins that's involved. This type of vein we can treat one way. This type of vein we'll treat another way. And they put together a plan and they go ahead and treat them. Now, the beauty of all of this is in the last 10 to 12 years, the procedures have come such a long way that they're super non-invasive. They're much easier to be done. Most of them are done in an office setting versus a surgery setting. They're about an hour to an hour and a half procedure. Most of them are done without any anesthesia at all. typically a local, and patients are very happy with it. Very little downtime.
Okay. And what's the expectation for the patient after, after the treatment?
So usually, as far as recovery goes, it's about a 2-week process recovery-wise. And by recovery, I mean some limitations as far as heavy lifting goes. There really should be no limitations as far as movement goes. So, being a new mom that's very busy with children, there is no real, we don't want you laying down. That's the worst thing you could do. So you want to be up and moving, life as usual is great. So a heavy lifting thing is one of the things that we want to avoid. We also want to avoid any kind of exercise that involves any abdominal work. So that's one of the things that, we kind of stress. Other than that, walking is great, moving is great, any kind of cardio is excellent. And that's one of the things that keep people from wanting to actually, do these surgeries, because they think they're going to be limited in their mobility, and they're really not. So it's not something that should keep you from investigating having these procedures done. One of the things that you do have to do, and you should have to do after these procedures, is compression. We suggest that you, and some require that you wear compression after the procedures for a little while to make sure that the veins heal nicely like they're supposed to. The recovery is pretty simple as far as how the veins look and how you feel. Within 2 weeks, your symptoms will pretty much be gone. They're tired, achy, and heavy. The legs feel much better. Visually, it takes a little bit longer. So you're looking at, usually we say, could take up to about 3 months to see the maximum results of these procedures. And then you can slowly start to work on some of the more cosmetic ends of it. But by 3 months, you'll see the maximum result, and then you can go from there as far as cleaning up whatever's left over.
Wow, that's great. How many patients do you guys say that you treat in a month? Is this a very much more frequent type of thing, or is it pretty rare?
No, it's pretty frequent. I mean, I could fill almost every day with varicose vein patients, I guess we could call them,
Wow.
And we could fill, we do our vein procedures on Fridays, and we could probably fill a whole day every Friday with vein procedures. It's very common, and it's not just women, it's men as well. But because of the hormone situations and the pregnancies, it's certainly more prevalent in women.
Okay. Well, thank you so much for talking to us today. We really appreciate your time. Thank you so much.
Oh, it's my pleasure. Thanks for having me.
We hope that you'll turn to Therafirm to help you with all your compression questions and compression needs.